Hello and good afternoon to you. How are you doing? Good. Well, welcome to your consultation today. My name is Courtney. It's really nice to meet you. So I just want you to get all comfortable and relaxed. This is going to be a really easy, simple consultation, so there is nothing to worry about. We're going to go through what surgery you are here for, your goals and any concerns that you may have. So I am all ears for the first part. Anything, just make sure to tell me and then we'll do an examination, okay? So just to begin with, I just want to go through some details with you first, get all your information on our records. Yeah, okay. So first things first, very simple. Can you tell me your first and last name? And can you just spell your last name? Yeah. Perfect. And what is your date of birth? Okay, can you tell me your medical history? Are you currently on any medication? Have you experienced any allergies or issues with anything in the past? Okay, yep, that's good to know. Yeah, that shouldn't cause any issues, not to worry. Alright, have you had any past surgeries? Alright, so what are you looking to enhance or change? Alright, so you're looking to have rhinoplasty? Yeah. And what is the reason why you are wanting that? Okay. Yeah, I can see a slight bend, little kink in your nose. Yeah, I can visibly see that. So you've been struggling to breathe. Yeah, it's covering your left nostril. Yeah. Yeah, that is one of the main reasons why we do have people come in for rhinoplasty. So again, it is something that we do very often. Yeah. It's mainly hard to sleep. Yeah, we'll take a look at all of that. And you say it's your left nostril. Okay. Okay, and do you have any concerns today about the surgery or anything else? Yeah, so the surgery time is usually between 1 to 2 hours, depending which option you go for, which we will go through the options a little bit later on. Yeah, and the recovery time is usually between 4 and 6 weeks. Although you will see a reduce of the swelling and bruising normally within a couple of weeks, but for the full recovery it can be a few weeks longer. Yeah, any more concerns? Being put to sleep? Yeah, a lot of people do get worried about that, but honestly, when it comes down to it, you don't even remember falling asleep, and then the next minute you know, you're awake again. Yeah, it is very safe. Yeah, not to worry. I'll just write these down. Do you suffer from anxiety? Yeah, that's good to know as well. I can definitely help you with that. Alright, so regarding the surgery, what are your goals? Okay. Obviously being able to breathe better. Yep, and the actual shape of your nose, wanting it straightening. Yeah, we can do that anyway at the same time. Are you wanting anything else doing to your nose? Yeah, you want to keep everything looking as the same as possible. Yeah, just more straight. Yeah, that's fine. Noses are actually very important to the rest of your face. Sometimes it can totally change how a person looks, so I totally understand that you are wanting to keep the overall shape. Yeah. Okay, so I think next what we're going to do is I'm going to take an examination on your nose, get an idea with what we're working with and how best we can help you. Okay, so I'm just going to pop on some gloves. How's your day going so far? Yeah, good. You've been excited? Yeah. A lot of people are. Okay, so are you all comfortable? Yes, okay, good. So all I want you to do is just straighten your face up and look right at me. So what I'm just going to do is I'm just going to have a feel around the outside of your nose to begin with. I'm just going to touch the end, make sure it all feels nice and hard. We like to do that because sometimes people's end of the noses need work on if it is too flat, but yours feels as it should be. Okay, just have a look at your nostrils. Okay, if you're okay just to tip your head back a little bit, I just want to have a look up there. I'm just going to get my torch just for a better look. Let's have a look. Okay. Yeah, I can't see where your nose is bent up your left nostril. I'm just going to check up the right one. Okay, so far so good. Next, I just need to take some measurements, mainly of the nose area. Alright, so I've got my caliper here. So first what I'm going to do is I'm just going to measure the distance from your eyes. Okay, so if you're okay again, just look straight forward, try and keep as still as you can. I'm just going to hold this up there. Let's have a look. Okay, that's good. And then now I'm just going to measure the distance from one side of your nose to your eye. So I'm just going to bring this a little bit closer. Okay, and I'm just going to do the other side. Let's have a look. Okay. Okay, that's fine. So just for my next measurement, I'm just going to measure the top of your nose just here, okay? So again, if you're okay, just to hold still. Okay. And I'm just going to take my tape measure here because I'm just going to measure this bit as well. So just hold this still. Looks a little bit tangled. Okay. So I'm just going to put that side there. Put it along. Are you okay? Good. This part won't take too long. Okay. Right, so next I'm just going to now measure the width of your nostrils at the bottom, okay? So I'm just gonna take my caliper. I'm just going to take this to the bottom. Just keep still. Doing great. Okay, that's good. I'm just going to take my tape measure again and just measure around the nostrils, but this way instead. To make sure my tape is nice and straight. I need to get this as accurately as possible. Okay. Okay, that's fine. What was that? Are you still feeling comfortable? Yeah, good. So next, just a little quick one. I just need to measure each nostril. Just when I was examining, I think just of the way your nose is bent slightly, your left nostril is a little bit wider than your right. So we'll take measurements and then we'll do the surgery. Hopefully we can get them both the same size. Okay, so I'm just going to take this. We'll do your left nostril first. Okay. Okay, so don't want to forget that. Let's do your right. Yeah, it is just slightly smaller, but that's absolutely fine. We can get that sorted for you. And then okay, now for the final measurement is just going to be the overall length. Are you wanting anything taken up a little bit, or are you still absolutely fine? Yeah, okay, that's absolutely fine. So I'm just going to take this and then just keep. Okay, just. Okay. Yeah. Yes, your nose is average length, don't worry. Okay, well, you've done really well so far. So I think next what we should do is go through your options and what I feel might be the best for you. Okay, so we do have two main surgeries for rhinoplasty, and it's a open or closed surgery. So the open surgery is a little bit more invasive, and what we do is we just do a small incision just underneath the nose there. Afterwards, you would never be able to tell that we have done anything to your nose. Okay, and then we'll be able to then flip this skin back. It's a little bit easier to access the inside of your nose this way. And the closed approach is less invasive, and we go up the nostrils and make incisions there. Yeah, okay, but considering the goals that you're wanting, I would recommend the open surgery. Yeah, that's just what I would think would be the better option for you. And like I say, the open surgery, you would not even know that we've done it, okay? It is really on the crease. Yeah, you think you're okay with that? You can have some time to think about it if you need. Okay, so we'll put you down for the open surgery. Alright, so that's everything that I need from you today. So what I will do is I will pass all your details onto our surgeon, and we'll give you a call and get you all booked in. Yeah? Okay, that's perfect. Well, thank you so much for coming in today, and we will see you very soon.